Are you very confused about the variety of suture materials which are available and how to choose the perfect suture material for the surgery you are performing? Absorbable, non-absorbable, delayed absorbable suture materials? Then this video is for you. In this video, we'll be discussing about suture material, its definition as such, then the types of the suture materials, absorbable, non-absorbable suture materials. Then we'll discuss about individual suture materials, their practice essentials, and stay tuned till the end of the video because we have some tips in the end. Hi, I'm Dr. Amerjeeth and welcome to The Scalpel, where you can learn about concepts in surgery, clinics, operative surgery, and practice essentials. If you're looking for a specific section, you can use the timestamps given below in the description to navigate through the video. The suture material is a medical device used to hold the tissues together. There are a lot of classification for the suture material. One is synthetic and natural. The name itself is self-explanatory. And the example for a synthetic suture material is nylon or Ethilon. And the example for a natural suture material is silk. Then comes monofilament or multifilament, absorbable or non-absorbable, coated or uncoated. We'll discuss about each of them later. This table looks very confusing, right? Don't worry about it. By the end of the session, we'll come back to this so that you will be able to understand each one step by step. So there are a lot of properties for a suture material. For all practical purposes, you should know at least these three. Let's discuss them one by one. First is tensile strength. So it is the force required to break the suture when both the ends are pulled apart. Basically, it means that when the tensile strength is zero, it doesn't hold the tissues together and it does not act as a suture. Let us take an example. For Catgut, the tensile strength is from a week's time to 10 days, but the absorption time is 70 days. So, after the duration of 1 week to 10 days, it does not function as a suture and it just retained there till 70 days for it to get absorbed. The second property is absorbability. It just basically means that whether the suture is getting absorbed by enzymatic degradation or hydrolysis or it is non-absorbable suture material. The third one is memory. So, it is the inherent capability of the suture to retain its original gross shape. You would have seen whenever you pull out a Prolene material, it just retains its zigzag shape. So that is called memory. It is usually seen in monofilament suture materials. What is the significance? So whenever a suture material has memory, then there is a high chance that the knots will slip and you will need excessive knots to keep the sutures in situ. Now let's discuss about monofilament and multifilament suture material. So as you can see, a monofilament suture material has a single strand, whereas a multifilament suture material has multiple strands and it can be a twisted or a braided. Now let's discuss about the characteristics of a monofilament suture material. So it has less infection rate, less capillary action, and has got a smooth tissue passage. That is why monofilament suture materials are preferred in case of a vascular anastomosis. Then it has got higher tensile strength, and as we have earlier seen, monofilament suture materials usually has memory. That is why the knots in monofilament suture material can easily slip. Now let's come to multifilament suture material. As there are multiple filaments in the suture material, the bacteria can easily get lodged into the suture material and there is high risk of infection. Then because of the same reason, there is high capillary action, more friction, and there is less tensile strength. And because of the multifilament nature, the knots in these sutures are much more secure. Now let's discuss about absorbable suture material. So all the suture materials we'll be discussing about the material, the filament type, origin whether it's natural or synthetic, color of the suture material, tensile strength, and absorption rate. When coming to catgut, so catgut is derived from sheep submucosa, and that's why it's called as cattle's gut or catgut. It's a monofilament suture material. It's natural in origin So whenever we say natural in origin, it will have a lot of tissue reaction. That is why we have two suture materials, which is plain and a chromic. So plain catgut has a lot of tissue reaction and also gets rapidly absorbed within 7 to 10 days. That is why they coated plain catgut with chromium so that the tissue reaction is less, the absorption rate is delayed, and also has better tensile strength. As you can see, chromic catgut gets delayedly absorbed by within 21 to 28 days, and also the absorption rate is delayed to 90 days, whereas plain catgut it's rapidly absorbed within 7 to 10 days. This is how the suture material looks like. And catgut is not commonly used nowadays, but some centers have been using it to suture mucosa. For example, in episiotomy wounds or mucosa of lips, intraoral suturing, then to suture subcutaneous tissues to approximate muscles, then to ligate superficial vessels, and also in circumcision surgeries. So just remember that it has a lot of tissue reaction, hence it should not be used wherever it is cosmetically sensitive. For example, face, neck, etc. Next, coming to Vicryl or polyglactin. Vicryl is a brand name and polyglactin is the material inside. So polyglactin is a copolymer of lactate and glycolide. It is a multifilamented braided suture material. It's a synthetic suture material, hence it has less tissue reaction, and the color is violet, or sometimes it can be undyed. Whenever we say undyed, it is white in color. Then the tensile strength, it is 60% by the end of 2 weeks and 30% by the end of 3 weeks. Absorption, it is absorbed by hydrolysis, whereas in absorbable suture materials, only catgut gets absorbed by phagocytosis. Right? Rest all absorbable suture materials gets absorbed by hydrolysis, and the absorption is about 60 to 90 days time. You can appreciate the violet color here. And there is another subtype called as Vicryl rapid. So as you already saw, the absorption time is 60 to 90 days in case of Vicryl. But in Vicryl rapid, this Vicryl material is irradiated so that it gets rapidly absorbed within duration of 7 to 10 days. This is commonly used for subcuticular sutures and also for surgeries like circumcision. Uses. So this is called a workhouse suture of general surgeons, and it has been very commonly used. So the commonly used purposes are bowel anastomosis, subcutaneous tissue approximation, muscle approximation, mucosal suturing, muscle suturing, bladder repair to ligate the vessels, and also in subcuticular sutures. And as we earlier saw, it has less tissue reaction. The next one is monocryl or polyglecaprone. So the material is polyglecaprone. It is a monofilament suture material. It is a synthetically available suture material. It is usually undyed, but sometimes it is violet in color. Tensile strength is up to 21 days, and it gets absorbed by hydrolysis within 90 to 120 days. Here you can appreciate the white colored suture material. And uses, it's used very commonly in pediatric age group for skin approximation, and also in adults for subcuticular skin sutures, circumcision surgeries, and also for mucosal surgery. It is very common when compared to Vicryl suture material, but this is a monofilament suture material. The next one is PDS or polydioxonone. It is a monofilament suture material. It is synthetic in origin, violet in color. So all the three suture material which we saw previously are violet in color, and it may have a single thread or a double thread in case of a loop PDS. And also the tensile strength is 70% in 2 weeks and 50% in 4 weeks. So this is actually a delayed absorbable suture material. And when you have to choose between delayed absorbable suture materials, which has to stay there for a longer period, the suture material of choice is PDS. And absorption rate is 180 suture, 180 days, whereas in Vicryl and polydioxonone, it was between 90 to 120 days. So this is how the loop PDS looks like. And there is something called as PDS plus, where PDS has been coated with triclosan and antibacterial. Coming to the uses, it is very similar to Vicryl. It is especially used for laparotomy closure of linea alba, and the double needle has been used for suturing small bowel in case of a side-to-side anastomosis. So next we'll be discussing about non-absorbable suture material and silk. Silk is one of the oldest suture material which is still in use, and as you know, it's obtained from natural silk from the silkworm. The multifilamented braided suture material, it's natural in origin, has black color, and we are discussing about non-absorbable suture material. But as you can see here, the tensile strength is almost lost by 6 months time, and also the silk may slowly get absorbed over a period of 1 to 2 years. But still, silk is considered as a non-absorbable suture material. And as it is multifilamented and braided, the knots here are very secure. And this is the suture material, and you can see the black colored multifilamented braided material. So as the knots are very secure in silk sutures, they are used for ligation of vessels and for securing the drains. But silk suture has higher risk for infection because of multifilament braided category. So the silk sutures are not preferred for skin suturing, but previously it was one of the very commonly used suture material for skin approximation. And till now, some of the surgeons use silk sutures in double-layered intestinal anastomosis, and also some of the surgeons use for duodenal ulcer perforation closures. So next we'll be discussing about Ethilon or nylon. So Ethilon, the material is nylon or polyamide. Ethilon is the brand name, and it's a monofilament suture material which is synthetic and black in color. So the tensile strength is lost about 15 to 20% per year, and it degrades 15 to 20% in every year. So Ethilon also, by the end of 5 or 6 years, it's almost absorbed. And as you can see, it's a monofilament suture material. It has memory, and the knots here are less secure. And this is how the suture material looks like. Coming to the uses, so this is one of the very commonly used suture material for skin closure, and it can also be used for abdominal wall mass closure, hernia repair, plastic surgery, microsurgery, etc. As the knots here are less secure, it requires at least 6 to 8 knots, and this gives the best cosmetic results. Coming to the next suture material, which is Prolene or polypropylene. So the material here is polypropylene. It's a monofilament synthetic suture material. Usually it's blue in color, and here you can see the tensile strength is infinite, and also it is a completely non-absorbable suture material. So even after 10 years or 15 years of time, the Prolene suture will stay as such. And this is how the suture material looks like. You can appreciate the blue color here. And this is one of the suture which are used for skin and subcuticular suturing, then commonly used for hernia mesh fixation, abdominal wall mass closure, and also in plastic and microsurgery. So Ethilon, Prolene, all these suture materials, if they are retained when used for skin closure, they can form sinuses, and later on it will have to be debrided, and only when the suture material is retrieved, the sinus usually heals. Come to the next one. Next we'll be discussing about Ethibond or polyester and linen. So these are not very commonly used. So material, it is polyethylene terephthalate. It's a monofilament or sometimes multifilamented suture material. Synthetic. Usually it's green and white in color. And as you can see, the tensile strength and absorption rate, it's infinite. And this is how the suture material looks like. You can appreciate the white and green color, and usually used for ligation of vessels and also used in cardiovascular surgery. Next we'll be discussing about linen. So linen is made up of long flax fibers, and it is multifilamented twisted. So till now all the multifilamented suture materials we were discussing were braided, but this is twisted. So it's synthetic, it's white in color, it loses the tensile strength about 50% by 6 months, and it's a completely non-absorbable suture material. So this is how the suture material looks like. And so nowadays it's not very commonly used, and if it's used for ligation of vessels and also in GI surgery. Then comes steel. So steel is an alloy of iron, nickel and chromium. It is a monofilament synthetic. Some people call it as natural alloy, and color is steel colored, and it has infinite tensile strength, and it is completely non-absorbable. So this is how the suture material looks like, and it is used for sternotomy wound closure. Now we'll discuss about special suture types. So the first one is barbed suture. And can you appreciate the small hook-like structures which are seen here? Those are called as barbs. So a barbed suture is a type of knotless surgical suture that has barbs on its surface. So while suturing the tissue, these barbs penetrate inside the tissue and lock them into place, eliminating the need for knots to be tied in a suture. And as you can see, even for the first knot, you need not take a knot, and you have to just pass the suture needle through this loop so that the knot is secure. These are very commonly used nowadays in laparoscopic surgeries, and for example laparoscopic tap, IPOM, even diaphragmatic repair, and also in bowel anastomosis. There are a lot of suture materials which are available for barb sutures, for example Prolene, PDS, Vicryl, etc., and you can choose whichever type you want. The next one is skin stapler. So this is a stapler and this is a stapler remover, and this is how the stapler machine works. So commonly the material is steel or titanium. It has less tissue reaction and it is used for approximation of skin. Next, one of the interesting topic, which is an ideal suture material. So an ideal suture material should have good handling characteristics, should be inert, should allow secure knots, have adequate tensile strength, should not cut through the tissue, it should be sterilizable and should be cheap, should be non-allergenic. And you should know that as of now, there is no ideal suture which exists. So now we'll discuss about the size of the suture. As you can see, as the number decreases, the suture material size decreases. But after that, from 102030, how many ever the number increases, if there is a 0 next to it, the size of the suture material actually decreases. So 10 is larger than 10, but 1 is larger than 20. And the 0 is actually called as odd. Odd means 0. And as you can see, the number increases, the size of the suture material decreases whenever there is a 0 next to it. So in this image, you can actually see the parts of a suture needle sachet. So this denotes the size of the suture material. This is 30, and this is imperial gauge size, and this is metric gauge size. And here you can see the length of the needle, whether it's cutting or reverse cutting, and this shows the length of the suture material, and this shows whether it's sterilized, and if it's sterilized with what? EO means ethylene oxide. This denotes that this is not reusable, and here it shows that see instructions for use in the sachet inside. And this is the expiry date of the suture material, this is the batch number, and this is the product code. So if you want to order the same suture material again, you should be using this product code to order it. Coming back to this table, as we know, the suture materials are classified into absorbable and non-absorbable. Among the absorbable, it's further classified into monofilament and multifilament. Non-absorbable is further classified also into monofilament and multifilament. So in the absorbable monofilament, we have monocryl, PDS, catgut and chromic catgut. The multifilament, we have vicryl or vicryl rapid. In the non-absorbable monofilament, we have Ethilon, Prolene and steel. In the non-absorbable multifilament, we have silk, polyester and linen. Coming to the tips. So usually for skin closure, for abdomen, we use 2,0 Ethilon. For limb, we use 2,0 or 3,0 Ethilon. For face or neck, we use 4,0 or 5,0 Ethilon. For eyelids, we use 5,0 or 6,0 Ethilon. For subcuticular suture, we commonly use 3,0 Ethilon or Prolene, which are non-absorbable. If we are using absorbable, then we can use 3,0 Monocryl, which is absorbable. And if you are using a non-absorbable, make sure that you remove the suture material after the stipulated period of time. So for a deep wound, you can use polyglactin or Vicryl to approximate the muscle and subcutaneous tissue. And for skin, you can use Ethilon or skin staplers. And for lips, you can use Ethilon to suture the skin up to the vermilion border, and then later on Vicryl or Monocryl to suture the mucosa and the muscle inside. That's it for today, and thanks for watching. If you like this video, share this with your friends and subscribe to my channel by just clicking right over here. And if you want me to make videos on specific topic, let me know it in the comment section. Thank you.